Hello everyone, I'm Kirti Kaushal, currently working as Assistant Professor in Lloyd Institute of Management and Technology. Today, I'm going to discuss a topic with you all that is easy way to memorize the drug names. Or you can say that how to remember drug name easily. Let me fix into your mind by drug suffixes. As you all know, in a pharmacology subject, there are numerous of drugs which are quite difficult to memorize them. So I hope this video will help you. So let me start. First of all, how to identify a drug. Suppose we have a drug and this drug basically belongs to a some category and this category may have some unique suffix. So by remembering the suffix, you can easily identify the category and you can easily remember the drug. Let me clear this by taking an example that is ACE inhibitor. So inhibitors are the drugs which are having the suffix that is pril. So by remembering the suffix pril, you can easily identify that they are ACE inhibitors. But sometimes we have drugs like benzodiazepines. Benzodiazepines have two drug suffixes. For example, first one have azepam and second one has azole. In such type of categories, we can remember the two or more suffixes belonging to that category. So, but many of the drugs belongs to one category which is having a unique suffix, which is the best tool to identify the drug and its category. Now in this video, you will go 40 types of drug categories which is having a particular unique suffix by which you can easily identify the drug and the particular category. Let us start one by one. My first suffix is afil. Afil indicates they are PDE type 5 inhibitors. PDE type 5 inhibitors are what? That is phosphodiesterase type 5 inhibitors. PDE type 5 inhibitors, the drugs include that is the sildenafil, tadalafil, all these ending with the same suffix that is afil, which indicates these are PDE type 5 inhibitors. So these types of drugs going to inhibit the phosphodiesterase type 5 enzyme, which actually converts the cyclic GMP into GMP. So because of this metabolism, the cyclic GMP level would be decreased and the GMP level would be increased, which leads to the vasodilatation. In this way, basically, PDE type 5 inhibitors are going to use as vasodilators. Particularly, they are used in the treatment of erectile dysfunction. My second suffix is that is your azepine. Azepine indicates these are dibenzazepines. Dibenzazepines includes the drug that is carbamazepine and oxacarbamazepines. These drugs having the action that is anti-epileptic action, but and also the both of the drugs ending with the same suffix that is azepines, which indicates these are dibenzepines. We should not confuse with these drugs with the benzodiazepines because benzodiazepines are of different chemical category. So carbamazepine and oxacarbamazepines belongs to the dibenzapines. These having the anti-epileptic action, they basically block the sodium channel. So by blocking the sodium channel, they can cause their action that is epileptic action and they can use as anti-epileptic agent. Our third suffix is azole. Azole indicates these are antifungal agents. Antifungal agent drugs are imidazole. Basically they have the imidazole nucleus, and second one they have the triazole nucleus. In imidazole nucleus, the drugs categorized are cotrimazole, iconazole, miconazole, ketoconazole. In triazole, the drugs are itraconazole, fluconazole, posaconazole, voriconazole. So, whatever may be the existence, whether it is an imidazole or a triazole, both are having the same suffix, that is azole. Azole indicates they are antifungal agents. All these are ending with the same suffix, that is azole, and azole indicates they are antifungal agents. Our next suffix is azosin. Our fourth type of suffix is azosin. Azosin indicates they are alpha 1 blockers. Alpha 1 blockers drugs indicates the parazosin, terazosin, doxazosin. All these are ending with the same suffix, that is azosin, which indicates they are alpha 1 blockers. They directly act as the vasodilators. Drugs, these alpha 1 blockers, they can act as vasodilators, and they can basically used in the treatment for the hypertension. Fifth type of suffix is bendazole. Bendazole indicates these are benzimidazole. Benzimidazoles, the drugs are albendazole, mebendazole, thiobendazole. All these are also ending with the same suffix, that is bendazole, and these indicates they are benzimidazole. These drugs can be used as antihelminthics. Antihelminthics are basically the group of parasitic drugs that expel the parasitic worm and other internal parasites from the body. So all these drugs can be used as antihelminthics. Our next suffix is caine. Caine indicates they are local anesthetic. Local anesthetic drug include, that is cocaine. Cocaine is the natural alkaloid obtained from the coca leaves. But also we have some synthetic local anesthetic, that is ester local anesthetic, and having the amide linkage, that is local anesthetic. Ester linkage of local anesthetic indicates the drugs, includes the drugs, that is benzocaine, procaine, chlorprocaine, tetracaine. And amide includes the drug lidocaine, bupivacaine, prilocaine, ropivacaine, mepivacaine. So the ester and amides both are having the same suffix, that is caine, which indicates that they are local anesthetic. So the drug, whether it is having the ester linkage or amide linkage, the drugs are having the same suffix, the caine. Next suffix is capone. Capone indicates they are COMT inhibitor. COMT is what? That is catechol or methyl transferase inhibitors. Drugs like entacapone, tolcapone includes the COMT inhibitors. These are also ending with the same suffix, that is capone. These drugs can given along with the levodopa to inhibit the peripheral metabolism. So thereby new dopa more cross through the blood-brain barrier, and then availability of the levodopa can be increased. Our eighth suffix is cillin. Cillin indicates that they are penicillin. Penicillin includes many of the drugs like penicillin G, penicillin B, ampicillin, amoxicillin, methicillin, piperacillin. All these penicillin derivatives used against the gram-positive and gram-negative infections. Our next suffix is cycline. Cycline indicates they are tetracyclines. The drugs include in this category are tetracycline, oxytetracycline, chlortetracycline, doxycycline, and minocycline. All these are ending with the same suffix, that is cyclic, which indicates they are tetracycline. They act as antibacterials by inhibiting the protein synthesis. So they can act as antibacterials. Our next suffix is dipine. Dipine indicates they are dihydropyridine. As the name derived dihydropyridine, from the dihydro, di would be taken, and from the pyridine, pine is taken. So that's in this way the dipine would be derived. Under the category of dihydropyridine, we have the drugs like nifedipine, amlodipine, felodipine, nicardipine. All these are the calcium channel blocker that can act directly on vascular smooth muscles. Our next suffix is floxacin. Floxacin indicates they are fluoroquinolones. Fluoroquinolones having the drugs that is ciprofloxacin, norfloxacin, ofloxacin, moxifloxacin. All these basically inhibit the bacterial topoisomerase. But also we have one exception in this case, that is nalidixic acid. Nalidixic acid is not ending with the same suffix, that is floxacin, but it is also used, it is also under the category that is fluoroquinolones. Nalidixic acid is basically one of the first generation fluoroquinolones. So from second generation onwards, all the drugs are having the same suffix, that is floxacin, which includes the fluoroquinolones. These are basically inhibit the DNA replication within the bacteria and inhibit the bacterial topoisomerase enzyme. Our next suffix is formin. Formin indicates these are bigonides. Bigonides having the drug that is metmorphin. Metmorphin is one of the drugs that reduces the hepatic glucogenesis. So these can be used as anti-diabetic agents. So metmorphin, the suffix is morphin, and they can categorize under the bigonides and having the action, the anti-diabetic action. Our next suffix is glin. Glin indicates they are MAO B inhibitor. MAO B inhibitors, what is the MAO basically? The monoamine oxidase type B inhibitors. Monoamine oxidase is what? It is an enzyme in our body that breaks down several chemicals in the brain, including the dopamine. So by giving the medication that blocks the effect of MAO B, or we can say that MAO B inhibitors, more dopamine is available. So it is which is used by the brain. So MAO B inhibitors having the drugs like psilocybin and reserpine. These inhibit the metabolism of dopamine in the central nervous system, hence used to treat the Parkinson disease. So seleglin and rasaglin categorized under the MAO B inhibitors. Our next suffix is glinide. Glinide indicates they are non-sulfonylureas. Non-sulfonylureas having the drugs that is ripaglinide and neetglinide. These are structurally not similar to the sulfonylureas but act like sulfonylureas. So glinide categorized under the non-sulfonylureas. Our 15th suffix is gliptin. Gliptin is what? Gliptin basically a suffix which categorized under the DPP type 4 inhibitor. DPP is what? That is dipeptidyl peptidase 4 inhibitor, type 4 inhibitor. So the drugs like sitagliptin and sexagliptin are the drugs which indicates these are DPP type 4 inhibitors. These drugs inhibit the metabolism of incretin like GLP. GLP is what? That is glucagon like peptide. So these drugs inhibit the metabolism of incretin like GLP and having the same suffix, that is gliptin, and categorized under the DPP type 4 inhibitors. Our next suffix is glitazone. Glitazone indicates these are PPAR gamma inhibitors. PPAR is what? That is peroximase proliferator activated receptor, basically the gamma receptor inhibitors. The drugs under this category are pioglitazone, rosiglitazone. These act on the nuclear receptor, thereby affect the hepatic glucose turnover. So they can also be used as anti-diabetic agents. So glitazone indicates they are PPAR gamma inhibitors. The next suffix is gravid. Gravid indicates these are integrase inhibitors. The drugs under the integrase inhibitors are reltagravid, dolutegravir. These drugs inhibit the merging of viral DNA with the host DNA so that the viral DNA cannot replicate in the host to produce the further new virus. So gravid suffix is used under the integrase inhibitors. Our 18th suffix is eposide. Eposide indicates they are podophylotoxins. Podophylotoxins drugs are etoposide, teniposide. These inhibit the topoisomerase type 2. Topoisomerase type 2. These drugs are used as anti-cancer agents. They inhibit the enzyme that is topoisomerase 2, thereby they inhibit the DNA replications. So eposide, basically the podophylotoxin. So basically eposide suffix are used for the podophylotoxins, or you can say that anti-cancer agents. Our next suffix is leucast. Leucast is leukotriene antagonist. Leukotriene antagonist drugs include montelukast, zafirlukast. These two are the drugs basically used to treat the allergic rhinitis by seasonal changes when our body give response like watering of eyes, sneezing and all. So these are the drugs which is basically used to treat the allergic rhinitis. So leucast, the suffix which are basically indicates they are leukotriene antagonist. Our next suffix is MAB. MAB indicates they are monoclonal antibodies. Monoclonal antibodies, the drugs are rituximab, cetuximab, epciximab, trastuzumab, omalizumab. So these are the drugs ending with the same suffix, that is MAB, which indicates they are monoclonal antibodies. So few of all the drugs can act as anti-cancer agents and few of can act as biological modifiers to suppress the immunity. Our next category is metazolin. Metazolin indicates they are nasal decongestant. The drugs under the nasal decongestant are the oxymetazoline, xylometazoline. These two are the drugs which are ending with the same suffix, that is metazolin, which indicates they are nasal decongestant. And they can be the imidazole derivative that act on the alpha-1 agonist. So our next suffix is navir. Navir indicates these are the protease inhibitors. Protease inhibitors having the drugs that is sequinavir, indinavir, ritonavir, emprinavir, darunavir. All these are ending with the same suffix, that is navir, and indicates the protease inhibitors. These are the drugs inhibit the viral protein synthesis and thereby they inhibit the HIV replication also. So these are protease inhibitors. Our next suffix is nidazole. Nidazole indicates they are nitroimidazole. Nitroimidazole having the drug metronidazole, tinidazole or nidazole. These are also ending with the same suffix, that is nidazole, which indicates they are nitroimidazole. which are used to treat the diarrhea and amoebic infection. Our next suffix is olol. Beta blockers. Olol indicates these are beta blockers. We have like many of the drugs like propanolol, nadolol, timolol, etinol, metoprolol, ismolol. All these are the drugs which are ending with the same suffix, that is olol, and these are the beta blockers. These are actually the aryloxypropanol amines. Some of the drugs like propanolol, nadolol, timolol, these are the non-selective beta blockers. And some of the drugs like etinolol, metoprolol, ismolol, these are the selective beta blockers. So whether the beta blockers are selective or non-selective, both are ending with the same suffix, that is olol, which indicates they are beta blockers. Our next type of suffix is penem. Penem indicates they are carbapenems. Carbapenem having the drugs like imipenem, meropenem, ertapenem, which act like penicillin and inhibit the cell wall synthesis. Carbapenem is one of the most popular drugs which are highly effective against the bacteria, or basically these are the effective antibiotic agent. So our next suffix is platin. Platin indicates these are the platinum compounds. The drugs under the platinum compounds are cisplatin, carboplatin, oxaliplatin. These are the drugs act as an alkylating agent, and they can acting like as anti-cancer agents and act as the alkylating agents, and they inhibit the DNA replication. Our next suffix is, that is our prazole. Prazole indicates these are the proton pump inhibitors. Under the proton pump inhibitors, we are having the drug like omeprazole, rabeprazole, pantoprazole, lansoprazole. These are the drug inhibit the gastric acid secretion. These are ending with the same suffix, that is prazole. Prazole indicates they are proton pump inhibitors, which basically inhibit the gastric acid secretion at the gastric parietal cell. Our next suffix is pril. Pril indicates they are ACE inhibitor. ACE inhibitor. That pril having the drugs like captopril, lisinopril, ramipril, and enalapril. These are the drugs inhibit the conversion of angiotensin 1 to angiotensin 2. And these basically can be used as antihypertensive drugs. Our next suffix is pristin. Pristin indicates they are stereogramins. Stereogramins. Stereogramins having the drugs like quinupristin, dalfopristin, which inhibit the bacterial protein synthesis. So pristin, the suffix pristin indicates these are stereogramins. The drugs like quinupristin, dalfopristin, pristin having the same suffix for both of the drug. These are basically inhibit the bacterial protein synthesis, and these drugs are also given in the combination to treat the bacterial infections. Our next suffix is quine. Quine indicates these are aminoquinones. The drugs under the quine, under the same suffix quine, are the chloroquine, mefloquine, primaquine. So these are the drugs under the aminoquinolines. These are the drugs both having the 4 amino and 8 amino quinolones, but ending with the same suffix, that is quine. So these are the aminoquinolines. Our next type of suffix is rubicin. Rubicin indicates they are anthracycline antibiotics. Under the anthracycline antibiotics, drugs are doxorubicin, denorubicin, epirubicin, idarubicin. These drugs inhibits the DNA polymerase DNA polymerase. These drugs indicate basically inhibit the DNA polymerase. Then thereby they inhibit the DNA replication in the cancerous cell also. Our next suffix is sartan. Sartan indicates they are ARBS. What is ARBS? Angiotensin receptor blockers. So ARBS is angiotensin receptor blockers. Under the angiotensin receptor blockers, the drugs are losartan, valsartan, olmesartan, telmisartan. And the drugs basically antagonize the AT type, angiotensin type 2 receptors. So they can be used as antihypertensives. Our next type of suffix is cetron. Cetron indicates these are the 5-HT3 antagonist. 5-HT3 antagonist having the drugs like ondansetron, granisetron, tropicetron, dolacetron. These drugs can be used as anti-emetic agent, anti-emetics. So anti-emetics, when we give the like chemotherapy and all, so to control the nausea and to control the vomiting, we give the 5-HT3 antagonists. Like these are the drugs: ondansetron, granisetron, tropicetron, dolacetron, which can control the vomiting and used as anti-emetics. Our next suffix is statin. Statin indicates these are HMG Co-A reductase inhibitors. So under the statin suffix, we have drugs like simvastatin, lovastatin, rosuvastatin, atorvastatin. So these are the drugs reduce the LDL cholesterol in the blood. So they can be used as anti-hyperlipidemic agent. So these drugs reduce the LDL cholesterol, thereby they decrease the risk of coronary disease by about 25%. So all these drugs ending with the same suffix, that is statin, which indicate the HMG inhibitors. Our next suffix is ticaine. Ticaine indicates they are camptothecans. So drugs under that category, under this category basically, are topotecan, irinotecan. So topotecan, irinotecan inhibit the topoisomerase type 1 enzyme. So these are the drug ending with the same suffix, that is ticaine, which indicates these are the camptothecans. So these basically inhibit the DNA replication again. Then our 36th suffix is thiazide. Thiazide indicates these are the thiazide diuretics. Drugs under this category are chlorothiazide, hydrochlorothiazide, bendroflumethiazide. So these are the drugs act on distal tubule and inhibit the sodium or chlorine symport. So thereby these can inhibit the reabsorption of sodium and other cations. So these are ending with the same suffix, that is thiazide, which indicates they are thiazide diuretics. Our next suffix is thromycin. Thromycin indicates these are macrolides. Macrolides having the drug like erythromycin, clarithromycin, azithromycin. The drugs ending with the same suffix, that is thromycin, which indicates they are macrolides. These drugs basically inhibit the bacterial protein synthesis by inhibiting the translocation. So these drugs are useful basically for the inhibit the bacterial protein synthesis by inhibiting the translocation. So these are the macrolide antibiotics also. So our next suffix is tidine. Tidine indicates they are H2 antagonist. H2 antagonist. Under the H2 antagonist, we have drugs like cimetidine, ranitidine, famotidine, nizatidine. These drugs inhibit the histamine-mediated gastric acid secretion, and these drugs can also used as anti-ulcer agents. And all these drugs ending with the same suffix, that is tidine, we can easily like categorize them like these are the H2 antagonists which act as the anti-ulcer agents. Our next suffix is tryptan. Tryptan indicates these are 5-HT type 5-HT10 agonist. Under this category, we have drugs like sumatriptan, rizatriptan, elmotriptan, zolmitriptan. These drugs used to treat the migraine headaches. So these drugs ending with the same suffix, that is tryptan. Our 40th and the last suffix is zolamide. Zolamide indicates these are the carbonic anhydrase inhibitors. Under the carbonic anhydrase inhibitors, the drugs acetazolamide, dorozolamide. These drugs used to treat the glaucoma and mountain sickness. So these drugs ending with the same suffix zolamide, which indicates they are carbonic anhydrase inhibitors. So this is all about the 40 types of drug suffixes, its categories, some of the uses. So I hope you will find this video helpful for you. Thank you so much.